Hello and welcome to another series of Real Israelis, Real Lives, a seminar where we speak with ordinary Israelis living truly extraordinary lives. And this week, our guest is Dr. Aluma Al-Qaim Damiano. And Dr. Al-Qaim Damiano, you are a pediatric physician at Wolfson Medical Center in the neonatal intensive care unit. Thank you so much for joining us today.
Thank you for having me.
Can I ask you to share just a little bit about yourself in terms of what ordinary life looks like, perhaps prior to October 7th, your job, your responsibilities?
So I live in Tel Aviv, center of Israel. I think most of you know, and I work in Wolfson Medical Center, which is really close to my home. I'm a resident there. I finished med school in Italy and in Israel, and the daily life, I'm work in the pediatric department, in the neonatal intensive care unit, in the pediatric emergency room, also in pediatric clinics. So everywhere around, seeing pediatric patients
Okay.
on
Okay.
a daily basis.
I'm imagining it's a very busy day for you.
I'm actually after a really long shift. We have a 26-hour shift, so I'm recuperating from that.
Thank you so much for joining us after 26 hours. That's unbelievable. I wasn't even sure it was legal to work for 26 hours, but there you go. Can you tell us a little bit about how life has shifted for you for the hospital and in terms of the responsibilities of your work since October 7th?
So regular days were just, just like as in Canada. I think there's not much of a difference. You go to work, you have either a regular day or a 26-hour shift, but it's the regular routine. And October 7th really, I don't know, made us speechless, let's say. And the next day, it was as if nothing happened in terms of work. I had to go, there's still pediatric patients that needs to see a doctor. You cannot withhold them the care because of everything that's going on right now. So immediately after, still when everything is still going on and the area is not clear, there's still like a lot of fear of infiltration to Israel.
Mhm.
And you're sitting and you're accepting patients because they still need your care. On this is in terms of the clinic. We had to change the whole location, the whole department of the neonatal ICU. The place where it was, proximity was not a secured place for the babies, for the newborns. It wasn't in a shelter and there wasn't anything close. So we had to move all the neonates and the premature infants to a completely different building. Keep in mind that some of them are intubated, sedated, they cannot breathe on their own, and we had to transfer them to a different location.
How many
Uh,
children are we talking about? How many children are in the hospital at any given time?
I'm not sure, like, I think around the hospital, well, it changed a lot. Okay, obviously, people were even afraid to come to the hospital. Okay, patients were even afraid to come to the hospital. So we did see a decrease in the amount of new people arriving to the hospital, new patients.
Okay.
Normally, in a normal day, we have a pediatric department about 30 people, and then there is a pediatric surgery department, also around 30 patients. The neonates, the healthy neonates are about 40 patients. The neonatal ICU is about almost 20 patients. And of course, the amount of that are arriving to the pediatric emergency room, either to be kept with us or to live at home with their health. So we are talking about a big amount of people. The neonates that we had to transfer department were about 20. Some of them are have, for example, 27-week old twins, 27-week gestation, so
Wow.
born prematurely.
And you had to
Yesterday I
move
received
all
also.
of these children because in the event of a bomb attack or air raid sirens go off, the building is simply not set up to withstand a rocket impacting.
Exactly.
So where
So
have you
now we are in
taken all of these? Where have you taken all of these children?
So we've taken them underground, basically in the pediatric building. There is an underground floor where they are safe. So we are safe when we are dealing with them. And now, in the case of an alarm, we don't have to move them because it's physically possible to move someone that is intubated. You can't just take him away from his machine. He simply cannot live like that, even if it's just for fits. We've taken them there. They're safe. We still have a problem that whenever I go to receive a new patient, premature infant, or even not premature, even a 40 weeks infant that is born that has whatever kind of a problem, I still have to transfer him, let's say about 10 minutes walking with the whole incubator, sometimes needing respiratory help. Really hoping there wouldn't be any alarms when we do that, because obviously the road is not safe.
This is
Yesterday,
outside the building?
outside the building. We have to move them between buildings, between the delivery rooms and the neonatal ICU, which is about 10 minutes walking.
Wow. Wow. So when those moments you are holding your breath, hoping there is no siren.
Usually the dad is with us, is coming with us. I keep telling them, pray that the next 10 minutes go safely, because it can be a real problem.
How many sirens have there? You're right in the heart of Tel Aviv, correct?
Yes.
So how many sirens have there been recently? Is this something on a daily basis? For those who are watching at home, maybe in Montreal, maybe around the world, what is the sirens like in terms of running to bomb shelters in Tel Aviv at the moment?
So except for the ceasefire period,
Right.
it's a daily thing. We had an alarm, I think 3 hours ago. We were in the shelter. It's a daily thing. We had on the first day, on October 7th, we had a missile hit one of my neighbors. The house is completely destroyed, and it's simply a daily thing. That can happen every day, every hour, unfortunately.
How are you managing to work in what is ordinarily a stressful situation with now rocket sirens going off every day? What does that do to your stress?
I think nationwide, the stress level has been incredible since October 7th. I have a lot of family in the south, so that was also a big factor. Also in Kfar Aza, which is an area, a kibbutz that was really damaged from the infiltration. Fortunately for me, everyone's safe in my family.
Thank God.
But I think, yeah, the stress level is intense, but we have no other choice. When I'm a physician in charge, and there is the father is coming with me, and they're stressed about, they just went through the delivery of their kids. They're stressed about the information, about the situation. I'm taking with me to the neonatal ICU the non-healthy ones.
Right.
So they're stressed as much enough as it is.
Right.
And it's my job to keep them as relaxed as possible and let them know that we'll do everything we can for their baby, and we will take care of them. And so we have to be strong for them in that time, because they're having a really hard time in the moment, and we simply have no other choice.
As I'm listening to you, I don't know if you think of yourself this way. I'm pretty sure you do not. I'm seeing a hero staring back at me right now. Like what you are doing and what you are describing is nothing short of heroic. A family has a baby, whether it's born prematurely or there are medical complications. They need to go to a neonatal ICU. And under the threat or actuality of rocket fire, you are having to stand up and calm down the family. You're playing the role of psychologist and therapist while simultaneously being their doctor, being their pediatrician. It's inspiring. It's inspiring to listen to you and to hear you. Do you see yourself as somebody literally saving lives, or is it another day in the office?
It's hard to think about it that way. You're doing whatever you can, using the things you've learned, using the things you've learned for the past years in order to help someone. You're feeling to help someone. Saying I'm helping someone is something that sounds extreme, but you're doing everything you can in order to help someone medically and also emotionally for the parents. That's also a part.
You've spoken about some of the challenges and some of the difficulties. What is it that gives you hope? What is it that gives you your strength?
I think first of all, it's doing. For me, I'm a person who does. I'm not a person that speaks a lot. I like to do things. So that's what I like about my work. I'm physically doing a lot, and I'm always busy. I'm not, whenever you sit at home and you have the time off, which is not a lot, but when you do, you're always on the news and you're looking, and it's depressing. It's difficult to watch the news, even though you're living it, but it's still hard to see it. And I think when I'm more active, I find it easier to cope with everything when I'm doing what I can, which is to treat those babies. I feel like, I can promote something and I can hope for something better.
That's incredible. That's incredible. We are so proud of you, and we are so appreciative for what it is that you do. A concluding message to those who may be watching the recording or listening to this as part of our podcast. What would be a message that you would like to share with perhaps Jewish people outside of Israel at this time, who are nervous, who perhaps are afraid, who are watching the news maybe a little too often and too frequently, coming from the heart of Tel Aviv in the neonatal unit of Wolfson Medical Center? What would be a message that you would like to share with people?
I think mostly that I really feel the support of the Jewish community. I've always been a huge fan of Jewish community abroad since I've been there, and I understood how it works. And I really understand that a part of us being safe here is the Jewish community being our ambassadors abroad and keeping us safe. And I really appreciate those my friends abroad in Montreal, in Dolo de Zamor, that have contacted me and asked how it was and keep texting me. And if you know someone in Israel, message him, ask how he is. I think that really helps us to feel like we are one family.
Amazing. Amazing. It is so important what you said. And I'll just repeat it. If you know somebody in Israel, send them a text message. It's so small and it's so simple, and yet Israelis appreciate it. It has a larger than life impact as a result, just to let somebody know you care. So powerful, so simple, and yet so profound. Dr. Aluma Elkayem Damiano, thank you so much for joining us. Thank you for your time. I hope that you get to go to bed now or sleep after 26-hour shifts. I'm in awe of you. Thank you so much, and keep up your incredible work. Thank you.
Thank you, Mark. Thank you for every guys. Thank you.
Bye.